Hey GP learners, so this is a slightly unusual episode that you're going to have. This is actually going to be a recording of an open patient meeting that I had at our practice as we're moving towards a total triage model within the practice that I work in. Many of you probably think I've already been doing it for ages. I've been doing online consultations for ages, but total triage is a new thing that we're shifting towards for particular reasons that I'll explain throughout the video with our patients. And you also get to see the engagement I get from the patients themselves throughout this episode. Important to note that there are definitely some lessons I learned from doing that, and I will cover those in an upcoming episode, and hopefully that will be really effective for any of you looking at doing similar with patient engagement as well as change within your appointment systems. And I'll probably end up capturing some of this off in separate episodes as well, so that might help you in other areas as well. Slight apologies, my shirt was tucked in, but it looks a bit weird at the start. You'll figure it all out, and some of this was definitely done on the hoof and things as well. So I hope you find this really useful and effective. Timestamps will be down below, and as ever, we'll be here to catch up with you afterwards.
So we are live. So just to mention hello, first of all, I'm Dr. Hussain Gandhi. I'm one of the managing partners here at Modality Wellspring practice. And the reason I've opened this up to our patients is because we wanted to let you know about some of the changes that have happened locally, both to the practice and to the area. And also because of those changes, some of the things we're going to try and change to make, hopefully, access and appointments better for you as our patients. Because we know we do some things really well and we don't do other things really well. And I completely accept that and appreciate that. So we're hoping that this will be a way that we can move them a little bit forward, as well as respond to some of the changes that have happened and comments that you yourselves have been giving us for the past few months as well. Okay. So I'm going to talk about something called Modality Wellspring, which is a slightly different name to the Wellspring surgery and what that means. I'm going to talk about something called Modality Windmill, and some of you may have heard about the changes as one of the local practices as well. I'm then going to talk about the appointment system, give you an update on the current staff that we have, and then I am going to ask for your feedback after that. Okay. Again, if you can't see this clearly, apologies. I had to move everything at the last minute. We were meant to be downstairs and we're not allowed to be there at the moment. And that's why we've got a slightly smaller screen, so apologies on that. So, Modality Wellspring. So, some of you may or may not know about some of the changes that happened towards the tail end of last year. Joanne Sherwood, who is our long-standing practice manager, retired, which was well deserved. She'd been working at the practice for over 20 years and a key part of the practice. And Dr. Kaplan as well, similarly, also took the decision to retire at the same time. The challenge that led in terms of running the management of the practice, that effectively left myself to manage the entire practice. And as a single person trying to run a practice of over 10,000 patients, I'm sure you can imagine that's a big challenge. We had recruited a new practice manager at the time. Unfortunately, within a couple of weeks, for personal reasons, he had to leave the job. As a result of that, we had no management structure. And that was a clear challenge for us. And you may have noticed towards the tail end of last year, things didn't work as smoothly as we would have liked, but I'm being absolutely honest. So then it was a question of what we do to try and keep things running, because the priority we've always had is to try and keep the practice open. And at that point, I explored looking at other options in terms of what can mean stability for the practice. And at that point, we approached a group called Modality. I will talk about them in a second. And as of the 1st of January, the practice team merged with Modality and became Modality Wellspring. So, as I said, from the 1st of January, we merged with Modality. Now, I can play this video if you want. It's about 3 minutes. I appreciate the sound may not be good enough for everyone to hear. Did you want me to play it? So the video hopefully should explain that. But as I said, there are a lot more people here than I anticipated. I'll give it a play. I apologise, it's as loud as I can make it.
We're a leading provider of primary and community services. We've come together on the basis of like-mindedness. We're honoured to have the opportunity to serve more than 400,000 patients across the country. Working at scale requires a lot of hard work, but it brings many benefits to patients and staff alike.
I love the fact that the idea of Modality is that we try and keep patients out of hospital as long as we possibly can.
Our dedication to patients can be demonstrated through our community outpatient services, where we promise to see patients within 4 weeks of referral.
always seeking new and improved ways of delivering care to our patients. For example, enhancing our primary care teams to provide continuity of care and upskilling our workforce to be the best that they can possibly be.
The best practice comes from working with our colleagues, working across boundaries, sharing innovation, sharing best practice, and delivering a robust and cost-effective service to our patients.
I think working at scale and working as a team, divisionally and nationally, is the building foundation of Modality.
Modality definitely encouraged training and development, with 2 of our nurses actually starting the nurse practitioner degree.
The receptionists were all going to learn how to be care navigators and signpost patients, so the care for the patients is going to be much better.
When I think of Modality, I think of my friends, and I've never felt so appreciated, so valued and so nurtured in my professional career as what I have felt since we've merged. You know, we're all part of a movement where we're not afraid of embracing change, and we're not afraid of taking up new ideas. And a lot of these ideas are of real benefit for patients. And for me, that's a major motivating factor in being part of Modality.
Through Modality, I've met some great leaders who have shown passion, commitment, and dedication, especially when we have had challenges. They have stepped up and led by example.
For me, Modality means an organisation that wants to do things differently, that wants to be an innovator and to share best practice across the system.
Stuff that we would never have been able to do by ourselves. Different ways of working, looking at our workforce and figuring out how we can do things better. That's all part of the innovation.
I feel very empowered to do what I'm doing. I have a tremendous amount of support in being able to make changes and deliver those changes, and I think that comes from having a strong leadership team.
We're on an exciting journey. We're never going to figure everything out, but we believe we have the right mindset. Together, we can tackle any challenges that comes our way. We are ready to keep playing our part in shaping the future.
So just to expand on that, Modality itself is a national partnership. It's UK based, to be quite clear on that, because I know sometimes people have questions about large companies and that kind of stuff. And effectively, they started out in Birmingham, and over the past 15 years, they've now spread to other parts of the country, including North Yorkshire, London, eastern part of the country, and now Nottingham as well. And it's still based on aiming to have practice within your population, within your community. And as you heard, very much focused on trying to deliver community services close to hand to patients. The reason why I mentioned them specifically is, as I said, there was another change that happened earlier on in the year, which was the closure or potential closure of the windmill practice, which, as many of you know, is not that far away. It's literally half a mile down the road and stuff. And that was a decision taken by the partners at the time to hand back their contract. As a result of that, the practice went up for procurement. So that's always been the worry that happens, that a practice can be taken over by anybody. That can be a good thing sometimes, and that can be a different thing sometimes. And out of the bids that came through, Modality actually put through a bid that meant that they are now running the windmill practice as well. And just to talk about that a little bit more, that has led to some positive changes, because actually over the past couple of months since that happened, we've been talking to the practice team there a lot closer, and that potentially means that we may be able to bring some services that we've not been able to offer here at this practice, and that people have had to go to other places, potentially closer to home. Okay, we're still exploring that. Frustratingly, there's a lot of bureaucracy that comes with that, a lot more than many people would expect. It's not simple to just suddenly start providing a service from here and there, but it is something that we're keen to try and support all our patients with as well. Additionally, what we're hoping is it does mean we've got a bit more resilience in terms of being able to offer cover. So we have had some days where we've literally only had one doctor in the practice because of sickness and other factors. Hopefully this means that we've got a little bit more coverage and support and stuff. So that's what we're hoping, that by working together, we can actually offer potentially more and clearer service to all of you, our patients. So this is a link. You are welcome to use it on your phones or not. I'm going to show you what comes up in a second. I am going to show you what comes up in a second. But this is for those who either are watching at home and wanted to have a look at it in more detail, or if you wanted to look at this afterwards and stuff. And this is the survey results from the National General Practice Survey. So this came out about 2 weeks ago. So this is your perspective of how we are doing as a practice. Okay. So these are the results as of that survey. So this, again, is the national survey. This isn't the one that we've done ourselves. We have done a couple in the past. And I appreciate it's a little bit smaller for those of you here in the room. I will try and talk around most of what's on there as best as I can. So for our practice, so again, this is the national one. This goes to all people across the whole country. 563 were sent out. So that's approximately 5% of our practice population. Out of that, 129 people responded. Okay, so about 1% of our practice population responded to this. We got an average rating of 74% in terms of overall experience in our practice. I know you can't see that. Compare that to the national average. The national average is 74%, and the local average in terms of what's called the ICS, so the Nottinghamshire average as well, is 74% as well. So basically that says we are average. Okay, not great, not awful, average. I'd clearly like that to be better. Okay, some of these other factors, again, we are average. Some of them we're pretty good. Some of them we have room for improvements. Okay, so specifically, if we look at some of these, so this one here is a good experience of contacting the GP practice. Our reading came out at 69%. Now that doesn't sound great, I'll be honest. But if you look at the national average is 67%, and the local average is 64%. So we are doing a little bit better than others in the local area. In terms of ease of contacting the practice by the telephone, we were 56%. Again, the national average, I believe, is 56%. Sorry, it's a little bit blurred actually. And the local average was 46%. So again, some elements and stuff. And I can go through some of these others if you want more detail. But again, majority of these things basically say that we are pretty much average. I would like to be better than average. So this part's the same again. This one talks about that the health professional had all the information they needed about you as a patient when you contacted us. So we came up at 92%, which was similar to other places. The one I wanted to show you was trust. Apparently you do trust us still at the practice, which is really positive news for me. So 94% of people felt they could trust the practitioners here at the practice. And that is above average compared to other practices. So through that and through other surveys and work that we've been doing for the practice, we have had a few comments that come through that mean that actually there are things we know we can definitely improve on. Okay, and I'm going to talk about 4 of those things right now. So you said that you can't get through to us on the phone. I'm pretty sure everyone has had an experience where they've tried to ring us and either it rings off or it's engaged. Okay, and we know that that's a problem. There are a couple of reasons for that problem. The first one being, I'll be honest, our demand is astronomical. On a Monday morning, before 10 o'clock, we have over 300 calls coming into the practice, and we have 6 lines. As you can imagine, there's a capacity challenge there, and that means that we won't be able to answer all the calls first thing on Monday morning. Admittedly, if you call later in the afternoon, lines are a bit quieter and that's possible, but I don't think that's good enough. So for that reason, we've actually gone out and we're changing our phone system. Now that may seem like a simple thing to do. In general practice, that's a really hard thing to do because we actually have to redo all the cabling and stuff within the whole building in order to have a new phone line in. Our hope is that this will be live in the first week of August. We are waiting for the electricians and everyone to say that they can definitely do it. And it's taken a while for us to get all that sorted. But the benefit from that is that we will have a telephone system that's not linked to the physical number of lines that we have in the practice. it would be based on our internet bandwidth, which can be changed, and therefore mean we potentially have as many lines as we need. That doesn't change the number of staff we've got to answer them, but at least we've got more lines and mechanisms to help you better. So, for example, you may have called, for example, an electric company in the past, and they say that you can press 1, and we will call you back when you're at the front of the queue. We will have a system that allows us to do that for you, so at least you're not having to sit there on the phone waiting all the time. There are various other things that the phone line system hopefully will allow us to do in terms of calling you back, and also recognizing when you're trying to call us, and also offer you quieter times to call back to as well. That's hopefully changed. You're not even going to notice though, because the number's still the same. Everything that you do is still the same. It's the back end stuff that means that hopefully we have a better capacity to manage your demand. The next thing I'm going to talk about is we know that there have been challenges for people wanting to sign in sometimes, coming in and there's a huge queue, and as a result of that, they're having to wait to sign in. Now, part of that is because of this being broken for many years. And believe it or not, to fix this is over £3,000. If you ask me, would I rather spend £3,000 on this or £3,000 on having more staff to see you, I'm afraid that the staff will always win. However, we have been able to try other systems, and as of the past month or so, we do actually have another way for you to sign in. You may have noticed at the front we have this picture of Helen with a lovely QR code, and I appreciate this is a system that works if you have a phone. I know, but it does mean that for those who are able, you can scan the QR code and it will actually arrive you rather than physically having to wait at the front desk to see a receptionist to say that I am here. Okay? I know reception is an issue for the data and stuff, so the other way to do that is we put it on that side where the reception for your phone is actually a lot better. Unfortunately, we can't change the fact this building itself sucks up reception like anything, and the middle of the room. I can't see Dr. X. This, hands down, is one of the biggest challenges. Now, there have absolutely been several changes with the numbers of doctors and clinicians that we've had at times. As you've heard, some have left. Majority of them have been through retirement, actually. So people work here till they want to finish their careers. But the challenge we have, and I've said this earlier, that we have more demand than we will ever be able to cope with. That's not inappropriate demand, it's just that people need help. But the reality is there are more people needing help than there are people of us. So we are trying to put in a system that means that we will be able to prioritize those who need our help for the right person at the right time in the right way. We're going to talk about that in a little bit, but we're going to use digital systems to help with that, which are still supported so that you can do that even if you don't have a smartphone. There are never enough appointments. The number of times I've heard this is I'd be a billionaire, to be honest. And yeah, I understand that. I've said this from the start, that we will never meet the demand that we have from our patients. I'm sorry to say, it's just not possible with the resources that we have. But we have still invested more in trying to deliver more appointments and more contacts. And at the end of this, I will show you the extra number of staff that we are now recruited and are staying to be here to help and serve you. So the appointment changes themselves. There's a couple of things I'm going to talk about. I'm going to skip that. It's the BMA video talking about general practice. But the key thing, and I have said this a few times, is the capacity that we have, the number of people we physically have to see you, unfortunately, is not enough for the demand that we have. As I said, you know, on a Monday morning, over 200 calls plus is what we see on average. And obviously, there's a challenge in meeting that demand and stuff. Over the past few years, burnout of our staff, so people being able to stay in the job, is a real risk. And actually, one of the reasons why many of the doctors don't work every day is because, I'm being brutally honest, working here every day is a quick way to a grave because of the stress and challenge it faces. I know that. I'm here most days, but I'm not here every day because I can't cope with it. But that doesn't mean that we don't want to be here to help you. We want to do that in a structured way. One of the other challenges I'm sure you all face is that pretty much 8:31, all the appointments are gone. And the response we have to give you as a practice is asking, is it urgent? And the challenge we now have is that everything has become urgent. And that's a real difficulty. Because when everything is urgent, to be honest, how do you know what is urgent? It may be important to you, it may be urgent, but it's hard for us to support you with that when everything is being told to us, it has to be dealt with now. And that's difficult for you, and that's definitely difficult for us. So we're going to try and create a system that focuses on having the right person see you at the right time. How are we going to do that? So I just want to show you something. I appreciate this doesn't project very well, and I will try and talk around this as best as I can. But this is what I do on an average day. Okay, so this bit, I appreciate you can't see as well, but this bit is basically this and this in one go. Okay, so this is the morning. This is my normal on-call clinic that I would start, and these are just basically time blocks, because what I'm actually doing is this. Every little one of those blue lines is a patient I'm then calling, okay, and then contacting and trying to figure out what services you need from us, what help you need from us, whether that's something I can sort out over the phone, whether that's something that we need to bring you in and for someone to see you for, okay? That's just part of the list. You can't see it here, there's about 20 little mini lines here. That's the extra stuff that we're dealing with, it's the urgent stuff as well. And then an afternoon clinic where I'm not on call, where I'm not responsible for everything that's urgent in the practice, is something that looks like this. So this is a routine booked clinic. This is a standard thing many of you probably experienced that you're, from previous years, where you come in, sit down and see the doctor and you go. Yeah. The reason I'm showing you this are the green blocks here. Okay. There's about, 16 patients booked into that, of which 4 are green. The green ones are the ones that didn't turn up. Not within my ability to do so. And to be honest, I don't agree with that as well for several reasons. But if you look at that, 25% of my clinic was wasted. Is wasted because that's people I could have been seeing that I didn't because they didn't turn up. And actually, most of the time, I will still call patients to find out what happened. And again, the reason they're green is because I'm not even able to get through to them on the phone afterwards. Now, that's not necessarily because of the fault of the patients that didn't turn up. Could be, but let's be honest, everybody has chaos within their lives, and sometimes reason that things go wrong. The other thing I'll tell you about every single one of those green appointments on that day, they were all booked 2 weeks in advance. So that is part of the challenge that we face with our population. Whilst the majority of people are very good at turning up for their appointments, we do look after a lot of patients that face chaos in their lives, and turning up in advance doesn't always work. So one of the things we are changing is we are going to take away the ability to future book and make it so that we can see you on the day when you want to see us.
But you're trying to cut down the ringing back sort of thing. Telephone calls. Yes. You can't diagnose anybody with telephone calls.
I disagree, but I agree that not everything can be dealt with on the phone. Okay? So what are our plans? Our plans are, the first thing that we will have is a digital first contact. Now I'm going to explain what that means, because that means different things to different people, and I will absolutely go through what that means here. One of the key things I know, and we talked to our patient participation group about this a month or so ago, is that the worry is when people talk about digital first, they immediately think you have to use a computer, and therefore if you don't have that, you can't do anything. That is not the case. Okay? For those that do not have the ability to use digital tech, smartphone, computer and stuff, our team will still be here behind the phone lines, be here behind the desk to help you navigate the system. The key difference is that we are going to ask you for your help to make that easier for those who can use the digital systems, because then it means we have more time to spend on the phone and in person for those that can, who can't use those routes and stuff. The point then is that information that's captured then goes to a clinician, and then they will filter that so it can be seen by the person who needs to see that. So if it's clearly obvious that patient A has contacted me and they need to see me, we will try and put them with me rather than who's available, because that's what's happening right now. We don't have the capacity to make that work. And one of the things we know is that continuity of care, you seeing the person you see on a regular basis.
So you say your staff will have the choice of whether you get to see a doctor or
No, not at all. Our clinicians, the doctors will. That's what I'm saying. And I'll show you what that means in a second.
I know you've got Google reviews about your staff.
Google is an interesting beast. I respect the reviews that we have and the comments that our patients have. I will point out some of those comments, we can't even tell if they are our patients. We don't know. But also for those that have had a difficult service, this is part of why we're trying to change it. So what does this mean for you? If you can use digital first, we would ask you to do that. The way to do that, you can do that through the website. And you may have noticed lately this lovely green banner that's been on our website for the past couple of weeks, which allows you to submit a digital request directly through that. The better way to do that is through the NHS app. And the reason why that's the better way is because the NHS app verifies that it's you who's doing that request. Because again, we live in a modern world. Technically, anybody could do anything if they wanted to. But the verification process through the NHS app is secure, and it gives us the knowledge that it is you, the person that we're talking to. And to support you doing that, we have actually got people coming into the practice to help those. So we've run a clinic last week with our digital coordinator supporting people, and we will continue to do those over the next few weeks as well. When you get a request that comes through, if you click on the website, if you go through the NHS app, this is the first screen that you'll be met with. So this is our test patient Bugs Bunny, okay? And you will be asked to either put an admin query or a medical query. Because we know that sometimes people contact us and they don't actually need an appointment. They want to chase, or they want a result, or they want a prescription, or something else. And actually, like going to the doctor to handle, it's not really appropriate. Medical stuff, absolutely. That needs to go to our clinicians. So that's the first choice you will have. Because it's digital, because it needs to be safe, you will be reminded about these are some of the things that actually you shouldn't be coming to us about. So if you're having crushing chest or chest pain, to be honest, coming to see me here at the practice is one of the worst things you could do, because it's delaying the care that you need, and where you need to be is in the hospital. If you're having symptoms of a stroke, you're bleeding out again. Good as I would like to be, I'm not going to be able to help you in that situation. The hospital is. That's just a quick reminder that will come up every time because it has to. What you will then have is questions that come up asking you what the issue is. So this is the admin one that you can see here. Just a couple of examples. It could be that you're being asked for following up a referral that you've had to the hospital. It could be that you're after test results. It could be that you're after a fit note or something. And then there'll be some additional questions. And the reason for doing this is that this means that we can get you to the right part of our practice quicker and easier. Okay. This is the medical one. 6 questions in total. What's the problem? Do you want to add a photo if you want to? How long has it been going on for? Have you tried anything yourself? Is there anything in particular you're worried about? What would you like us to do about this? And tell us the best times that we can contact you. 6 questions. And from that, that gives us a better idea what the challenge is that you're facing. And the reason we're asking this is this will go straight to our doctors. So then they can figure out where the best part of our system is to help you. Whether that is seeing you in practice, whether there is a phone call, because actually it may not need you to come into the practice, or you're not able to. Whether it is going to the pharmacy first, or whether it is actually you need to go to the hospital or something else. And the reason we need to do this is because right now, and I will be absolutely honest, it is first come, first serve. And like I said, at 8:31, we're full. And our hope is by having this information first from you, we can actually support those who need our help, signpost those who need other help more effectively. Now, it does mean that you need to give us that information. And doing that digitally, very easy. You can do that from the comfort and the confidence of your home, wherever you are, safely and securely. Quite rightly, some of you are thinking, I can't do that on my phone. I don't want to do that on my phone.
We just can't.
Yeah, can't, like I said. So when you call the practice, our reception team will ask you these questions, document it for you, and that will then go to the clinicians. They're not going to decide what happens with that. They will just capture that information, ask those questions to you, so that we can use that information to get you the right care, right time, in the right way. This is a change. It is structured. So they will be asking just those questions. We may ask a couple of clarifications, obviously, if we need to. But these, so we can then help and support you more effectively. Final thing I want to talk about is the staff changes. I said that we put some time and investment into changing the staff that we have here at the practice. You've even seen some of them come in and out because the practice has still been functioning throughout this as well. So, as I mentioned, I'm now the managing partner for the practice. We have recruited a new manager. It's somebody that you may have come across in the past, Rebecca Pierce. She's going to come back from her maternity leave as our new manager for the practice. We have 8 additional GPs working here at the practice. That's the most we've ever had at the practice. So just to go through those names, Dr. Ben Davis, Dr. Richard Thomas, Dr. Caroline Swindon, Dr. Alex Kupfer, Dr. Rajiv Wajasuriya, Dr. Farah Sufyan, Dr. Sarah Perot, and Dr. Jessica Lee. Those are regular doctors. That's not to say we may not have some additional locums come in when we are really short, but these are our regular doctors that work here on a regular weekly basis. We have a couple of GP trainees still. Some of you may have come across them in the past few months. These are doctors that come in to train, stay here for a while, and then leave because they go somewhere else to train. So Dr. Lamborton and Dr. Batharachi. Okay. Additionally, we have some nurses, so Laura Ritchie and Karen Hooks have been here at the practice for many years. We may potentially have another nurse starting soon, but because it's not confirmed, unfortunately, I can't put their name on yet. We also have PAs working at the practice, so Sahar Abasi, who's currently on maternity leave and hopefully due to come back later on, probably in January. And a new person to the practice, Lena Bogle, who works as a physician's associate. We have a couple of pharmacists, Nitin Lakhani and Jumana Al-Asadi. We also have a GP assistant who works like a healthcare assistant, Emma Gallagher, working at the practice. This is the largest our clinical team has been. In fact, so large that some days we actually run out of rooms now, which is a problem, actually. We don't have enough rooms to offer you the care that we would like, and it's something we're looking at as well. So I've been talking for about half an hour or so, and actually there's loads of questions coming in on the chat, and which I will have a look at in a second. I will happily try and answer as many of your questions as I can. I would ask, if you are asking a question though, try not to put too much personal information in. Again, it is being live streamed. Please do remember that and stuff, because I want to protect your confidentiality, your health information and stuff. I will try my best to answer what I can, go through it. I was hoping that Thomas would be here today to support some of the onboarding of patients who want to know more about the NHS app, but I believe it looks like he's not been able to turn up. He will be coming back to the practice every week or so to provide sessions for those who want to know how to use the NHS app more, because if I'm being absolutely honest, the best way to access this practice moving forward, easiest way, is through the NHS app. But if you can't use it, we will still be here to help you through our reception team and our admin desk. Before you leave, if you don't have any questions, I would really appreciate it though if you could fill in just this quick feedback form. It's the QR code and the link.
So why aren't you doing treatment here? Why have we still got to go down the square for bloods and treatment?
So yeah, the treatment room services. So that's one thing that we have repeatedly asked for support from the ICB to help provide to our patients. I'll be absolutely honest. It doesn't give us enough resource to make it that we can do it. For us to provide those services from here, because of the premises cost and some of the charges that come with it, we would end up losing approximately £30,000 a year as a practice. That's staff members that we wouldn't have. That's doctors and nurses that we couldn't have to support you. So to provide those services for our population costs more than we would actually get back from it. Now, it doesn't mean that we shouldn't do it, but at £30,000, to be honest, it's not something we can do. That's the significant cost. So that is provided by, the original decision was it was held in this building by the people who did used to provide it. They took the decision that it was too expensive to stay in the building and moved out.
I had a cancer put out my leg.
Yes, but you can load up with the medical transport, can't you?
No idea.
Yes, you can, because I've done it. I've had cancer.
What, to take you down to the square? There's nowhere to park, is there?
What's name, take you to the hospital, appointments, etc. And you got, usually give you about 2 hours before your actual appointment. But I can give you the number if you...
No, that's all right, thank you.
So I've got some questions coming from online. So Nicholas asked a similar one: why do we have to go into town for bloods? I'm hoping I've answered that. I'm not lying here. The reason is it will cost us more than we will get back from it.
You used to have it downstairs, didn't you?
So that was provided by a separate provider, who, like I said, they had to stop because the cost of staying here was too much.
Talking about these people take that on, is there any way they can do home viewers? Take blood at home?
So the
people, the way you send it, getting in that place is a nightmare unless you've got a mini scooter you've had.
I know, and we are trying to our best to bring a separate clinic here for things like bloods in particular. We are still trying to negotiate that with other powers that be. In terms of home visiting, again, the challenge is that it's the same contract. You have to do everything. You can't just do one bit of it. So we could potentially do some of those things. We just can't deliver all of them because the cost of it is just more than we can bear. And I know I'm talking about money and it's not nice, but I'm being absolutely honest. I can't agree to do a service that means that we're going to lose that much money from what we can do.
One thing, like when the prescription is not properly synced with the new pharmacy downstairs, like you have to come back and forth to check it and stuff. It's not come through.
So the systems that send it through electronically should work. We know that obviously when the pharmacy was taken over back in October, I think it was, there was some absolute chaos at that point. I can guarantee that was probably one of the worst weeks in my life. So for those patients who got caught in it, I can appreciate it was not a great time as well. In terms of tracking the prescriptions that come through, so it may help if I explain how it works, because a lot of people don't know how it works. You put a request in, that goes to our admin team who check whether that's an okay medication to be issued to you, whether if it's your regular medication or not, and if it's in date. From a safety point of view, we have to make sure we're prescribing things that are safe. If that's the case, the prescription is generated and it's sent. If it needs a review, it has to go to a clinician to check it's safe first before it can be sent. Once it's sent, it goes through the cloud, straight to the pharmacy.
On the NHS app, can you request
Medications you can request through the NHS app. And again, I will be quite clear on this because we had this question earlier. The best way to do it is through the NHS app because the NHS
medication regular.
True. Through
like
this
certain medication I have, I can't order on that.
Yeah. So I'm not going to deny the NHS app has some ways it can be better. So the system, unfortunately, is only designed to show you the medications when they're ready and due within a few days. Through this system, if there are medications that are not on your repeats, or if there's a reason why that medication is needed at a different time, you can then tell us. And the only thing I would ask you to do when you do that is give us the reason. Often I have many patients asking for medications, and unfortunately, the reason for that we don't get. And again, we need to know the reason why you suddenly need it out of sync, because again, we're talking about medications. Some of these can be medications that have extra rules around the safety of them. So what I would ask is that if you do need something give us the detail. And through these systems, that detail comes straight to the clinicians. It's not through the reception team, unless you say so.
Downstairs, there is a form to fill out when you're requesting.
Yep.
Is it going to be online now?
It has always been online available, and I would always ask the safest way to do it is through online. We should not be taking those requests verbally over the phone. Through COVID, the peak of COVID, we changed that because it was safer to do it that way.
Sometimes I don't need all my prescription, so I don't tick the box.
That's fine.
But now they've started sending it to the chemist.
Mm-hmm.
I got a whole rack of stuff that I didn't need, so I just give it back to the chemist.
That's fine. I'll be quite clear, we are not linked with the pharmacy over the road. I know they've got the same name. The fact that they've taken our name is an issue, but we are not the same organisation. And I know that has confused people, particularly with the name change that happened in October. But we are a separate organisation. We are separate practice.
Could I just ask, please? I'm a little bit confused.
Sure.
Say, for instance, tomorrow morning, not that I've ever used it, I'm afraid. Do I just go into appointments, and is there a facility there to contact you?
There is.
Through appointments on the NHS app.
So, if I remember rightly, the exact workflow is. Sorry?
It says you cannot contact you through this.
Right now, you can't. So, because of safety, we switch it off at 4 o'clock. So, instead, we ask you to call. And the reason for that is, obviously, if it's submitted as an online request after 4 o'clock, we may not see it before we shut. Unfortunately, we can't have somebody sitting there 24/7 waiting for them to come in. So we switch it off at 4 o'clock. So then you have to call us, because actually, A, the phone lines are quieter, and B, we can actually then deal with that in a supportive way. So right now, the reason why it's not available is because it's after 4 o'clock. In terms of answering your question, sir, so you can do that through the NHS app if you want to.
And you fill in that triage.
That form will be there. Yeah.
Form.
Yeah.
You do that actually on your phone, do you?
You can either do it on your phone. If you're not feeling well enough to do that, absolutely, you can still ring us. Our reception team will then ask you the same questions and capture that information.
They will do that for you.
They will do that with you.
With
you.
Right.
Because they don't need the information from you. They can't obviously make it up.
Okay. Just to recap then. If for some reason I can't access the NHS app, I've forgotten my password or whatever, or and I don't know how to reset it or whatever, I can still use the same phone number as we've always used. Is this correct?
Correct.
Yeah. And the receptionist or whoever answers that call will fill in that those triage questions for me.
With you.
With me.
Yeah.
Sorry. And things will operate as they used to do. Is this correct?
Similarly, yes. So that information we captured with our team, that will then go straight to the clinicians. It will prioritise, obviously, the ones that...
It will triage again.
Yeah. It'll be done by the clinicians that it comes through to. So our admin team are there to capture that information with you. And then that information then goes to the clinicians. So every morning, every afternoon, we have one dedicated clinician who's just going through those lists. At the moment, we have 2. The reason we have 2 is because to call you back for every single contact takes so much longer to clarify that information. So actually, because we get some of that information already from yourselves, we know that it's going to be quicker. And we've actually trialed this already. The reason we trialed it is we want to make sure it works for you when we go live. And we've trialed it, and actually, it seems to work. There's still a few kinks. That's the benefit of a trial. You can work out the problems.
Yeah.
But actually, we did this yesterday, and we saw more patients yesterday than the number of calls that we had coming through in a ratio compared to previous days.
I would dearly like to sort of practice making this appointment on the NHS app. But of course, how do you do that without actually making an appointment?
So you can go all the way through until the end and just not click submit, obviously.
Really?
Yeah.
Oh, okay.
So you can test it if
So
you
I
wanted
can
to.
go home and I can.
Yeah.
do
I'd
it.
ask if you're going to test it, just don't click submit, because otherwise we may end up contacting you, and then obviously,
Yeah.
you know, we want to make sure we're contacting you for the right reasons,
Yes,
not for a test. But absolutely, there is there. I've actually just been creating a video to show all the patients how to do it yesterday.
Right.
So I've just got to finish editing it and stuff,
Okay.
and that'll be available to send out as well.
Right. Okay. Thank you.
You know, you said if you didn't feel well enough to do it,
yes.
Could you get somebody else to do it for you?
Absolutely.
Yeah. Could they have to identify themselves to do it for you, or just go through the motions?
No. So obviously, parents can do this for their children. Children can do this for their parents.
Yeah.
Absolutely. Siblings and stuff. Again, the best way is through the NHS app. Now, obviously, that requires you to have to give somebody else your NHS app phone or whatever. Alternately, it can be done through the website. The difference when doing it through the website is that it doesn't verify that it's you through the website. So when it comes to us, we have to do an extra step to check. And the reason why sometimes that's not correct is if your legal name is slightly different to the way you typed it in, it doesn't always match, and we have to go through an extra step just to check it's the right person. So obviously we want to make sure we're dealing with the right person and stuff. And sometimes people do miskey, spell things differently, it happens. That's not a problem, but that's why I say using the NHS app is better, because it automatically verifies you with our system. There's no disconnect. But yes, you can do that. Someone else can do that for you, as long as they confirm that they're speaking with your consent. Because we, again, consent and information is an important part of this journey for all of us. No?
Are the doctors, the clinicians, or are the clinicians different?
No. So majority of our clinicians are doctors. There are a couple of times where we've had, for example, some of our nurses help out, and that's been generally when we're short. Yeah, but majority of times it's going to be the doctors.
So when you get to clinician, it's medical.
Yes,
person.
absolutely.
So when you submit the info through the app,
yep,
reception won't see that.
So obviously, if they've taken that with you, they would have seen it. Our reception team will see that information in terms of booking your appointments back. So, for example, if I'm that doctor and I've seen that and I've asked them to contact you,
right.
Obviously they may be able to see it. But I guess one of the key things I would push, because I know sometimes people worry about this concept of confidentiality with our reception team. I'll be very clear, our admin team are trained on confidentiality. A lot of their job is making sure they're doing things right, which is why they're so diligent at checking, are you the person we're speaking to, asking for your details. And a lot of the stuff they do is to signpost you to the right places as best as they can. That's because things change so quickly. You've seen the number of different people working at the practice. That was different just 2 months ago. That's how quickly things are changing. And actually, there are more and more resources we are accessing to try and help you. So you've seen some people come through. We actually have a separate hub clinic working in this building, providing extra capacity. It's not just our practice, but some of the other practices in the area. That's because we know we don't have enough capacity. And actually, some of our resources are used to supply that extra resource there. Now, it's in the same building. It's really fortunate for our patients. It happens to be in the same building, but it's a completely separate resource. And our team can book you into that if we're full. We can only do that with your help. So we want to make sure we're giving you the best care that we can with what we have.
What are you trying to improve on things?
Sorry?
Are you trying to, no, changing, is everything going to be improved?
That is absolutely, I'm hoping that the reason why we're doing all this work is that you have a better service from us. That's the aim.
Because sometimes to make an appointment, I have to wait 3 weeks.
So part of the change we'll make is that actually we hope that the capacity on the day will meet what you need better, so then you won't have to wait 3 weeks. Okay? So I've had a question. If a patient's told that results will be reviewed in 6 months, will there be an automated reminder, or is a patient required to rebook review appointment after 6 months? So I think if we ask that you need to come back to us in 6 months, we can't book you ahead 6 months, I'm afraid. We don't have the ability to do that. We can send reminders, that requires your phone to be working, and sometimes that is a challenge. But obviously, we would also ask if you know that you need to come back to us, just let us know. Because with the new system, on the day, we will come back to you with a response. That's one of the things we are aiming to provide you. That on the day, you'll get a response. As long as it's not something like 6:29 in the evening, because it may not come at that time. So one question, what if you need a referral? Do you do this on the app? I guess if you're chasing a referral, that's a great way to contact us because it's an admin thing. We just need to chase it up for you. If it's about making a new referral, often that does need a discussion with the clinician first. So we would ask that you send that to us and we will manage the request and hopefully get that to the right person so we can see you and support you from there. But I guess that they're the differences between those two. I'm not quite sure I understand this. So if you have an extra hub, I think I meant to be hub team, why are reception not offering appointments for this service? So if that's talking about the hub, we do, and that's shared between 7 practices though. So as you can imagine, the capacity that's there does also go very, very quickly, but it is pre-triage and stuff. So ideally it's particular things that can be seen in the hub. But again, capacity is a challenge. They offer 40 appointments a day across 7 practices. As you can imagine, those 40 appointments go very, very quickly, just like ours do.
So I hope you found that useful, EGP learners. If you want to contact me about any other routes of trying to do this for your patient groups, etc., or if you want more tips and stuff, then definitely check out this video once I've recorded it. That'll show you all those tips and hints and stuff and things and how to do patient engagement. Alternatively, if you want some more content for patients directly, then check out this video series right here. It'll give you all that content. Catch you soon.